Hello, I am Shannon, and today I'm going to review basic life support. This is a compressed version of the course, and through this course you will be able to get the information for recertification for BLS. I'm going to review a few things, do a few demonstrations, and have you watch a video of Ken Jeong doing Staying Alive, and that will give you the rate and rhythm of compressions. The link will be below or also on our corporate website. Upon completion of this course, for the purposes of your credentialing and records with our company, your name will be on an attendance sheet and that will be turned into the manager. If you need further documentation or would like an American Heart Association card, you will do a test out and I will also get you that card and we'll talk about that at test out. So let's get started with the information. During this video, we are going to discuss team dynamics, CPR, choking, and the use of the AED. First, the team approach. For best outcomes and to work efficiently, we will need to take the team approach with clear roles and responsibilities that will improve the outcomes of the situation. You will need to have clear communication, and during these situations, you will need to know your limitations. Second, CPR. We start with evaluation of the situation. We'll see if there's any chest rise or movement. We'll check the carotid pulse for 5 to 10 seconds to make sure there is no pulse. If no pulse and no breathing, and remember gasping is not considered breathing, you are going to call for help, call 911, and get the AED. High quality chest compressions, there's the positioning which is between the nipples. For adults, it's 2 to 2.4 inches of compression. You'll use the heel of your hand with your other hand on top with your fingers laced. For children, it's the 1/3 depth of the chest, which is approximately 2 inches. And for infants, it's 2 fingers and approximately 1/3 the depth of the chest. With infants, you can either do it on your hand or on your lap. The ratio is 30 compressions to 2 breaths. The focus is on the quality of the chest compressions. The airway may be compromised, blocked, or there may be a neck injury. Allow for complete recoil of each compression to allow for adequate filling. Remember good position and do not lean on the patient, so stand upright and then do your chest compressions. Also, you may get fatigued by doing chest compressions, so every 2 minutes you'll want to switch out with someone else. A rate of 100 to 120 compressions per minute is for adults, children, and infants. Next, we'll talk about airway. So we can have an AMBU, a face mask, or you can do mouth to mouth. You want to make sure that you have your AMBU on with appropriate jaw thrust. If you do not have an AMBU, you can use just the mask and do mask to mouth. And if you don't have that, you can pinch the nose, tilt the chin, and then do mouth to mouth that way. You want to look for chest rise. That's how you know you're getting through. And you just want to minimally see the chest rise. You do not want to overinflate, as this can decrease cardiac filling. Next, we're going to talk about choking. First is the Heimlich maneuver on the responsive adult. If you see somebody choking, you'll want to go up behind them, grab them, and do 5 chest thrusts. If they become unresponsive, you will lay them down and you will start CPR right away. When you go to give rescue breaths, you will look into the mouth. If you see the object, feel free to grab it out. If it's easy to grab out with your fingers, do not perform a blind sweep. On an infant, you'll do 5 back thrusts, 5 chest thrusts. You'll check the mouth and the airway. Now, if the baby goes unresponsive, you'll perform CPR, and before you give the breaths, you'll look into their mouth and dislodge the item if you can, or continue with CPR. The airway is really important, but the chest is really where you want to focus, so that high quality CPR if they pass out. Fourth, we're going to talk about the AED. The first step when you get your AED is to turn it on. You're going to look at the placement of your pads, which is the right upper chest and the left lower chest. For children, there's smaller pads, and these are the same placement, and this would be used up to 55 pounds. For pediatrics, there's an attenuator so that the child will get the appropriate amount of joules. It is important that you find the AED, as early defibrillation in the link of the adult chain of survival is important because it can restore a normal cardiac rhythm. If there's a rhythm that can be shockable, the AED will advise. If the AED analyzes and does not find a shockable rhythm, you will do CPR. The team leader and the AED will let you know to clear the patient before it delivers shocks. You give the shock and then you continue chest compressions. A couple of special considerations would be if a patient was submerged in water, you would get the patient out of the water, dry off the chest, and then apply the pads and use your AED. If your patient has a really hairy chest, you're going to use a razor, which is most commonly found in your kit, and you're going to shave those areas and then you're going to use the patches. In summary, the sequence to remember is unresponsiveness and no breathing. You're going to call for help, call 911, get the AED, and start CPR. Another small note is if you have an unwitnessed child, you're going to first give CPR for 2 minutes and then you're going to call 911. If you find an unresponsive adult, you're going to check and clear the scene, you're going to call for help, call 911, and then you're going to come back and do CPR. Thank you for your time and attention. I look forward to seeing you at the test out. The test out for BLS is a 25-point quiz, and then witnessing a relevant hand-on positioning and demonstration of the skills necessary for BLS. Thank you.